I guess, having another diagnosis or having a recurrence of cancer in individuals. And we find that a lot of those studies are focused around prevention. What are things that we can do on a day-to-day basis that are going to help prevent degradation of our cells and prevent the risk that's there? And one of the things we find is that vitamins, minerals, and phytochemicals that are found in our foods have a really strong anti-cancer effect. And those phytochemicals and minerals and vitamins are found in a variety of foods, but a lot of them are found in our plant-based foods. So phytochemicals, a lot of times people will kind of refer to them as antioxidants. We hear about antioxidants, but phytochemicals are those chemicals that are naturally occurring in plant foods and plant chemicals, and they act as those antioxidants in the body. These plant chemicals do influence a lot of our metabolic processes in the body and help to protect and prevent sickness, prevent breakdown of cells. And they're really, truly kind of given that title of an anti-cancer food in many ways. So some of the roles of phytochemicals, or those things that kind of create that antioxidant effect in our bodies, are to stimulate the immune system. And we certainly know now, of all times, we really need to kind of build up our immune systems with all of this illness that is around. So there's a lot of studies around how phytochemicals can also help kind of in this COVID time prevent and reduce risk of developing COVID. So that's kind of an interesting side note of studies that are ongoing around this, but it is truly linked with helping to block carcinogens that are often linked with cancer diagnoses and risks, reducing inflammation, preventing DNA damage, and kind of help to repair our cells overall, reducing that oxidative cell damage. And oxidation is when cells are either exposed to a stimulant that breaks it down, or even it's an oxygen molecule that affects that cell. And so we see that in some of our foods, and you'll actually see a slide that shows oxidation to kind of give you a visual image of what that means and what it kind of looks like and how it might be important in that role of food as we look forward. It does slow the growth of cells for cancer, and it does or they do also help to trigger the death of those damaged cells and regulate the hormones. So here's a nice little visual image of an antioxidant, which are found, in our plant-based foods and found in others as well, because we do fortify foods with some of these phytochemicals and nutrients to help protect our cells and improve our overall health. But what that green little molecule is doing is it's giving this free radical, this red guy, this kind of crazy monster looking guy, I guess it's appropriate with Halloween here. It's giving it a molecule to help settle it down and make it calm, to prevent it from breaking down this healthier cell. And that's the whole goal. When we talk about healthy eating it from an internal perspective or from the inside out, we want to prevent the breakdown of our cells. We want to keep our bodies strong and healthy. And antioxidants and phytochemicals in foods do help to do that. So here's that image. Here's an apple. A lot of times kids and adults alike will eat apples each day. And have you ever noticed in the morning, if you cut your apple up before you bring it to work, or you bring it to school, or even in just a few moments after cutting your apple, you kind of get this brownish color to it. That is a representation of oxidation. The cells, the internal cells of that apple are exposed to oxygen in the air, the air in general, and chemicals and any pollutants in the air, and it does break down the tissue of that apple. And what we can do, and what we found, is one of the techniques to help prevent the browning of apples, especially when kids refuse to eat those brown apples because that must just not be very good for you, is we can add things like lemon juice or other plant-based items that have vitamins and antioxidants in them, and it helps to reduce that browning process. It helps to reduce the breakdown of the cells. And that's the same thing that we can kind of do with our bodies from the inside out, is adding those fruits and vegetables that have those strong phytochemicals and antioxidants in them. It helps to prevent essentially this browning or this breakdown of tissue in our bodies, and it helps to reduce that risk of damage there. So I wanted to show, some of the sources that are, linked especially with cancer and prevention, which a lot of these items over here on this right side where it says vegetables and fruits, if you notice anything about them, they're very colorful. We often in the world of nutrition and health, we encourage eating the rainbow, eating a variety of colors of both fruits and vegetables and a variety of foods, because we know that those fruits and vegetables that are really strong in color, whether it be a deep purple or reds and greens and yellows, they have a number of different types of phytochemicals within them that are very strong in reducing that risk for cancer. And so you can see tomatoes on here are one that's linked with lycopene. And some of these are, of course, some interesting names of the phytochemical, but all of them have a very good, strong relationship in the body when we consume them to prevent the breakdown of cells and to ultimately help to reduce the risk of cancer. And so we want to encourage you to eat more fruits and vegetables. And doing more of that will help ultimately in overall health and also some other things, especially as it relates to maybe some weight management areas. So I am one who doesn't really push restricting. I am all about adding the good stuff back. Adding more of the whole grains and the fiber and adding those cancer protective foods like we just talked about with some of those fruits and vegetables. Yes, I encourage individuals to work toward reducing the intake of some of the foods that increase the risk, like your high fat foods and fried foods. But I don't necessarily say, okay, you can never have those foods. It's all about moderation and really working to have more of the protective and less of those that increase those risks. And then, of course, working to reduce or replace some of the larger portions of those less healthy foods with maybe some foods that are a little bit lighter in nature. They're going to ultimately have more of the cancer protectiveness. They're going to help you maintain a healthy weight, and add some of those really good nutritious quality things into your life. Okay. Again, fruits and vegetables, I won't, harp on that cord too long, but, really incorporating a lot of plant-based sources for your overall intake. One of the main diets, quote unquote diets or meal plans that's been very effective and often encouraged and talked about as it relates to cancer and cancer reduction is a Mediterranean meal plan or diet. And that meal plan is so effective because its main premise and base is all around plant-based foods. And we know that plant-based foods are reduced in their amount of saturated fats. They have more fiber. They have more of those antioxidants that we want to put in the body. So incorporating more of that is the key. Limiting your high fat fried foods, snack foods, other foods that may, just add some of the, higher cancer risk food or ingredients. We want to reduce that. Okay. And then, of course, with grains, I often get questions about, okay, well, you say whole grains. Well, what does that mean? Well, whole grains are those that, if you think when you're driving by a cornfield or even, a wheat field, it's the wheat swaying back and forth. It's the base part of that plant. It's not refined. So if you're thinking, okay, what do I add? So that'd be something like a whole grain pasta. Quinoa is a really great grain. Some people don't know much about it, but it's a very high fiber, high protein, plant-based grain that you can add. And then, of course, if you're thinking, okay, well, what's processed? Our white flours tend to be processed. We've removed a lot of the nutrients there. We've removed the fiber there. So your wheat bread, your whole grain rice, some of the cereals, bran flakes, all of those are going to be your healthier choices to add less of the sugary stuff, the more simple grains there. And then with protein, everyone needs protein in our lives. We need it for cell regrowth, for healing, a number of different things. It helps with fullness. But we do want to limit the consumption of red meats, especially because of the high fat content within them. But also working to choose some of the leaner cuts of meat if you are someone who likes meat protein, and pushing maybe some more or adding more of those plant-based proteins into your meal plan. How you prepare your foods is also important to kind of consider when you're thinking about the health quality of what you're eating. Choosing to broil or steam or do other cooking techniques that don't need or require adding an oil or a fat for that cooking process are the ones that are going to be healthier in nature for you and reduce some of those cancer risk ingredients. And then lifestyle. So when we talk about lifestyle, that's that physical activity component. That's how we kind of walk through our days and be active in what we do, working to eat and consume a healthful diet with fruits and vegetables and all those things we talked about, but also maintaining a healthy weight. And if you're not at a healthy weight, working toward that. We're all works in progress. And so it's important to kind of remember that it's not all weight loss that has to happen in order to prevent cancer risk, but it does help to reduce the risk. And there are a lot of ways we can achieve that without following a restrictive meal plan by adding some of that good stuff back in. These are some techniques when you're eating out, choosing the low fat options, sharing a meal, avoiding some of the large portions. Those are some lifestyle behaviors we can do when we're eating out. And we all fall into that rushed lifestyle sometimes where we are eating away from home. And so just trying to be more aware of what we're putting into our body can be very effective to help reduce some of the risks that are associated with illness and especially cancer. So here's my rainbow, my colorful rainbow. I always encourage lots and lots of color at meals. And it actually is more appealing to the eye, and it can create a sense of fullness and satiety when we have a variety of foods at our meal. Even if those foods are ones that are a little lower in calorie count, it still gives us a lot of fiber. It gives us those phytochemicals and antioxidants, and we really want to push for that as much as we can, especially in the case of cancer reduction and reducing those risks, because it's such a strong link with helping to reduce that. These are some references that I have available, and should anyone want them, I'm happy to send them to you after this presentation. They go over some really good information in much more detail around each of those bullet points, but I wanted to make sure you had that, and feel free to ask for them following the presentation. And thank you. I'm glad you were able to participate in this conversation, and I'm glad you joined today.
Thank you very much, Carly. Our next speaker is from Elizabeth Wende Breast Care, and it's Salena Sachman.
There we go. Now I should be off mute. Let me just share my screen really quickly. All right, is everyone able to see the screen?
No, it didn't pop up.
It did not.
There you go.
Wonderful. All right, thank you. As Dave said, my name is Salena Sachman. I am the community liaison at Elizabeth Wende Breast Care. So my position is to go out into the community and talk to people about breast cancer screening and detection, and really hope that I give them information that they can use to speak to their doctors about what's best for them. So Carly, that was a really wonderful presentation on the role that nutrition plays in cancer prevention. And I'm sure that we all can sort of take a little bit from that and good reminders of what we need to do to be healthier in our own lives. Just like to thank Carthage Hospital for including Elizabeth Wende Breast Care in the 2021 Think Pink event. We would very much rather be there in person, but we're happy to safely share information with everyone on screening mammography and breast density. If you have any questions during the presentation, feel free to enter it into the chat box, and we will do our best to answer them at the end of the presentation. So today we're just going to talk about a few things. We are going to review Elizabeth Wende Breast Care, the services that we offer, and a little bit about the history of our facility. We're going to talk about current screening guidelines. We'll then discuss breast density and the important role it plays in breast cancer detection. And lastly, I just wanted to highlight a little bit about COVID-19 and how the pandemic has impacted breast cancer screening and cancer detection. So a little bit about the history of Elizabeth Wende Breast Care. Our office opened in 1975, and this is Dr. Wendy Logan Young. She had worked in a general practice at the time, and she saw so many women coming in and being referred to a surgeon for breast concerns and breast issues. She came to the realization that this is causing stress and anxiety, and these women may not actually need surgery. So, can we do things a little bit differently? Can we work a little bit harder to try and make this an easy process for women who are already very stressed out? So she went out in 1975, opened our office, the first freestanding breast imaging center in the United States. So in 1975, mammography was not yet standard practice. It was becoming standard practice, but it was really, really rough those first few years that she was in business. But she was committed to the idea that radiologists played a very important role in finding breast cancer and diagnosing cancer. She traveled across the country, teaching and training other radiologists, trying to get them to understand that it could be done differently, and she was willing to put in the time to help them. So mammography became standard practice in about the 1980s. And obviously when that happened, Elizabeth Wende Breast Care the business took off. So she has published several books on breast cancer detection. She's still known as a pioneer in the field of radiology today. So back in 1975 all the way to today, we have grown quite a bit. Today, we're a group practice of 7 fellowship-trained breast imaging experts. So really, what does that mean? It means that our doctors have gone through extensive training, advanced training in breast imaging, and they're able to do procedures to detect breast cancer, such as breast biopsy. They're highly specialized and differ from general radiologists because they only look at images of the breast. Imagine if you worked on an assembly line and your job on the assembly line was to make bike wheels. And all day long, you were looking at wheels. You were looking at the bike wheels. You would become really, really good at detecting any abnormalities that might be on that wheel. And that is sort of the same concept with our doctors, and that they are specialized in breast imaging. Their eyes have certain muscle memory, and they're able to view breast images to see if there are any abnormalities. And studies show that the more images a radiologist looks at, the better they are at detecting cancer, which makes a lot of sense, right? So what makes our office different? What makes Elizabeth Wende Breast Care unique? As I said, we have dedicated breast imaging radiologists. We are a high volume center. Because we are such a high volume center, we are always looking at the newest and best technology to provide for our patients, and approached for clinical research trials to bring those things for FDA approval. We do 3D mammography. It's known as tomosynthesis. We call it 3D mammography. All of our equipment all of our mammogram machines use tomosynthesis. Every patient gets a 3D mammogram at any of our offices. We do screening breast ultrasound for dense breast tissue, which we're going to talk about in a little while. We have a high risk program, a fully integrated genetics department, and same-day results through text or email for screening mammography. So you can see, let me get my pointer here. Our high-risk program and genetics department, I like to think of that as sort of a bonus that patients get without really realizing that they're getting this. So we have a very detailed health history form. We ask about personal and family history of cancer and other risk factors. And based on the information people provide to us, we run it through a computer system that generates a risk score. So we can talk to patients who might have a higher risk of breast cancer and offer different or additional screening methods that's based off of their family history. We currently have 7 different locations. We opened our Carthage office in July of 2018, and we're located at 3 Bridge Street in Carthage in the Carthage Hospital Professional Building. The services that we offer in the Carthage location is screening mammography, as I said, tomosynthesis with 3D, bone density testing, screening breast ultrasound, and diagnostic appointments. So we've talked about the services and where we are. Let's talk about these screening guidelines. So it seems like every time we turn on the news, we get the health alerts on our phones, and we constantly hear different and conflicting information about the latest and greatest health recommendations and guidelines, and breast health is no exception. The graphic here is a little bit busy. There's a lot of information on this, but I think it's a really good thing to share. It shows all of the different guidelines that are currently circulating. So it's a little bit confusing. You don't know what to read, what to know, what's best for you. It's very difficult to understand. So our doctors here follow the American College of Radiology and Society of Breast Imaging guidelines. These guidelines say to start at the age of 40, that there is no age limit to stop mammography, that you should continue to have a mammogram as long as you are healthy. You should have a mammogram every year, and tomosynthesis or 3D mammogram is a better mammogram for everyone. So we'll break down these recommendations just a little bit more here. This is a really good visual. These guidelines were just updated July of 2021 to include specific guidelines for minority women and for transgender folks with breast tissue. So minority women, especially Black women, are more likely to be diagnosed with more aggressive cancers by the age of 50 and have a significantly higher mortality rate than non-Hispanic white women. So for that group of people to have a cancer risk assessment by the age of 30 is very important, because if they are at a higher risk, they can be screened differently, hopefully to find cancer early when it is most treatable, because that is our ultimate goal here. So we still recommend, as I said before, annual mammograms starting at the age of 40. It is the greatest breast cancer mortality reduction, which means that if we can find something earlier, we can save a person's life. There's better surgical options and more effective chemotherapy when breast cancer is found earlier. And then I talked a little bit about that age limit. Some of those organizations that were on the prior slide said to stop screening at the age of 74. And for a moment, you can sort of think about someone in your life that you know that is 74 years old. They could play tennis, they could go dancing, they could be very active and be in really, really great health. You can also think of some 74-year-olds you might know who are not doing very well, that they have other comorbidities, they're using oxygen. It's difficult for them to get around. It's difficult for them to make, appointments and get to the doctor. At that point, it's a good idea to have a conversation with their doctor and make a decision whether it's a good idea to continue screening mammography when there's some other things going on with that person. So in any situation, the benefits should be considered along with the possibility of the risks. And the risks in this case would be a recall for extra pictures, breast biopsy that turns out to be benign, so not breast cancer, and a risk of anxiety of that additional testing. And that's going to change based on the person. So I think it's important to know a little bit about the history of mammography. So we're going to go through some things a little bit here. So this is a picture of mammography in the 1960s using industrial film mammography. We can look at this poor woman's face. She does not look very happy to be having that mammogram right now. The next is in the 1970s with zero mammography. That was the first commercially produced mammogram machine. The 1980s was film screen mammography. And the 60s, 70s, 80s, and into the 90s, the patients could expect there to be compression for an extended period of time. They could see film plates. There was dark rooms. There was film. Doctors with magnifying glasses trying to, take a closer look at an image. And really the limitation was that technologists had one opportunity to get the right picture. They would take the mammogram. They would go in the dark room, develop the film, put the film on a lit screen, and if the patient had moved at all, they would see that, and then they would have to retake the picture. So you could imagine that it was quite the process. So in the 2000s, huge advancement in the field of breast imaging was the shift to digital mammography. So digital mammography was great because technologists could see their image quality. So they would do the mammogram, they could look at the picture and see if it was blurry or if a patient had moved. And then they could say to the patient, looks like we have, you moved, we have to retake the picture right now. So it's less anxiety for the patient because they're right in the room. They understand what was happening. They would just have the extra picture done right then and there. This also allows doctors, our radiologists, to read images on a computer screen. So they can manipulate the images, they can zoom in, they can see things a little bit better, much more sophisticated than the magnifying glass that they were using before. At this point, digital mammography was still taking just one solid shot. So you'd have a picture of the breast top to bottom, picture of the breast side to side, and that's what the doctors had to look at. So in 2009, we started a clinical trial using this software, this equipment called tomosynthesis or 3D mammography. And this was really great because it allowed our doctors to see several different images of each picture of the breast. So in the 2000s here, they were only able to see one. In tomosynthesis 3D mammography, it's anywhere from 30 to 60 1 millimeter slices of your breast tissue that the doctors can scroll through and look at in any given time. So tomosynthesis is really the standard of care now. It's just a better mammogram for everyone. So this is why tomosynthesis is better. It provides greater accuracy. Doctors are looking at things and they're able to see things very easily that are abnormal. The scan is actually faster. There's less time under compression. It's usually about 10 to 12 seconds per compression. Detects more invasive cancers, reduces callbacks by up to 40%. So we talked a little bit about outweighing the benefits and the risk and the stress and anxiety caused by having to be called back. This technology reduces that by up to 40%, which is really huge for patients who are already coming in for they're very anxious about the exam that they're having. And it reduces the amount of radiation used to obtain the images. So as I said before, it's just a better mammogram for all women, but especially helpful for women who have what is known as dense breast tissue, which we'll talk about next. So the image that you see right here is a picture of 4 different mammograms on 4 different women. And this is how we classify breast density. So there are 4 categories that patients will fall into. So the first image here is fatty breast tissue. So you can see that this picture is pretty much all gray. It's pretty easy for radiologists to read because cancer and other abnormalities show up white on a mammogram. So if there is a big white dot sitting in here somewhere, pretty easy for radiologists to read and see that. The next category here is scattered. So scattered breast tissue, there's a little bit of fibroglandular tissue, which shows up white on a mammogram. That's more dense tissue, but it's mostly gray. So it's still pretty easy for doctors to read and look at this image. And then we move into more dense breast tissue. So you can appreciate the difference between category B and category C here. Category C, you're starting to see much larger areas here with that fibroglandular tissue. So this is dense tissue that shows up white on a mammogram. And a few seconds ago, I told you that abnormalities such as cancer also show up white on a mammogram. So it makes it more difficult for radiologists to read a mammogram on someone who has dense breast tissue. And the last category here is extremely dense. This is made up of mostly fibroglandular tissue and not as much fat. So it's very difficult for doctors to interpret images just with the mammogram. So what can we do here? In January of 2013, New York State passed legislation that said radiologists have to tell patients what their breast density is. We wanted to make sure that people had information they needed to make the best decisions about what services they needed and to talk to their doctors about what gives them the best breast cancer detection. So anywhere on a mammogram report, regardless of where you go in New York State, has to say the following information. I'm just going to read exactly what the law says we have to report, so just bear with me 1 second. Your mammogram shows that your breast tissue is dense. Dense breast tissue is very common and it's not abnormal. However, dense breast tissue can make it harder to find cancer on a mammogram and may also be associated with an increased risk of breast cancer. This information about the result of your mammogram is given to you to raise your awareness. Use this information to talk to your doctor about your own risk for breast cancer. At that time, ask your doctor if more screening tests might be useful based on your risk. Additional tests such as breast ultrasound have been shown to be helpful for dense breast tissue. A report of your result was sent to your physician. So we can kind of look at this another way. This is sort of a cartoon image of breast density. The image on the left shows a fatty breast, and this little star shape here represents a cancer. So it'd be very easy to see. The image on the right is a dense breast. And there is the same cancer, but there's a masking effect because that dense tissue, remember, it shows up white and abnormalities show up white. So if you have dense breast tissue, you should discuss with your doctor if additional screening ultrasound is the best way to go for you. So screening breast ultrasound uses sound waves to detect masses in the breast. It cuts through dense tissue to eliminate that masking effect that we just talked about in the previous slide. So people always ask us, well, if this is better, can I just have the ultrasound? Trying to get out of a mammogram, of course. And unfortunately, no. So the ultrasound sees things differently than a mammogram does. Mammogram shows things like calcifications in the breast. An ultrasound does not show calcifications. So we need to be able to see those Our doctors need to be able to see those because it could represent an early breast cancer. So screening ultrasound is used in conjunction with a screening mammogram, not on its own. So at any of our locations, mammogram and screening ultrasound can be done on the same day. So it's very convenient for you. You're just kind of making one trip. And a thing to note is that not all health insurances currently cover screening breast ultrasound. So any insurance that is underwritten in New York State will cover screening breast ultrasound. Other health insurances outside of New York State, there is no legislation to mandate that they cover that. So it's a good idea to check with health insurance companies before you schedule, just to be sure that you're not going to get stuck paying for something. So the last topic that I just wanted to touch on was COVID. So COVID-19 and breast cancer screening. And breast cancer screening came to a halt March to May of 2020. It was not recommended that people have screening mammography at the time. We were primarily seeing patients who had problems or concerns. We were doing very limited screening mammograms. And there was hesitancy from a lot of people to come back in. And I think a little bit of that still exists. It's causing lasting effects that we're still learning about, and we'll talk about that in just a second here. But larger cancers were found. People were avoiding care. They didn't want to come in. People have still not come back, and then the lasting impact is still to be determined. And I will say that doctors' offices, medical facilities, our practice, we have gone to great lengths to make it very safe and clean environment. You're in and out, really trying to minimize risk for people and anxiety associated with, whatever risk they may perceive that's there. So there are some new studies that are being released to talk about the impact that COVID has had on breast cancer screening. And you can sort of just see some of these impact of COVID-19 on breast cancer mortality. So how many more deaths from breast cancer because people delayed having mammograms. Early detection and screening, the impact, association with cancer, screening deficits in the pandemic, and what's going to be the long-term impact of people skipping or delaying. So we're a long way away from really knowing what the true impact was, but more and more research will be done, and I suppose time will tell here. So the last topic that I wanted to touch on regarding COVID-19 is the vaccine. So in March of this year, 2021, the media had gotten hold of some information regarding the COVID vaccine that it could cause enlarged lymph nodes and to not have a mammogram. Now, with everything we do, there needs to be education and understanding. And we spent a lot of time doing that with people over the phone because you hear on the news and then you wonder what it means for you. So we spent a lot of time really educating people on what it meant. So having enlarged lymph nodes after a vaccine is a normal effect. The shingles vaccine, the flu vaccine, you have a scrape on your arm, it can cause swollen lymph nodes. It's your body's response from an injection. Your body is building up its protection. So it can happen. And the Society of Breast Imaging released these guidelines for people who are not sure what to do with their mammogram. And it's starting to resurface again now because people are getting their booster shots or their third vaccine. So I thought it might be helpful just to add this to the discussion today. So this guideline says that try to have your mammogram before you get your next vaccine. If you are concerned that it might cause your lymph nodes to become enlarged, you can schedule your mammogram 4 weeks after your last injection, just to be sure that the body is regulated, that there may not be any false positives. You might not have to come back. Things will be settled a little bit more. Now, this here says, what should I tell my technologist? And what we have done is we are asking people to provide information about any vaccine that they've had. So if they've had the shingles vaccine, the flu vaccine, if they've had the COVID vaccine, that we're asking them, when did you have it? Which arm did you have it? So that if our doctors do see enlarged lymph nodes on a mammogram, they can have a conversation with the patients about what that might mean and perhaps schedule a short-term follow-up just to be sure it was from a vaccine and not anything that we need to be more concerned about. So that was all that I had prepared for today. I think that the greatest takeaway message that you can take from this is remind your loved ones to have their mammogram. It's very easy to get off track and to think I'll get to it when I get to it when you're taking care of everyone else in your life. But it's really important. It's a very short screening and it could just make a world of difference for your health. So thank you so much for your time. I hope that you take a little bit from this, and we'll turn it back to, I think, Dave.